12 cancer symptoms that most people ignore. Unexplained weight loss. While most people would be ecstatic to discover that they have lost weight, it should be a red flag. Losing 10 pounds in a month without changing your diet or exercise routine should cause you to contact your doctor. Unexplained weight loss could also be related to your thyroid, but either way, a doctor should run tests. Blood in the wrong place. Blood in the stool or urine can be signs of cancer. Most people may assume that the blood in their stool is from a hemorrhoid, but it could be related to colon cancer. Having blood in your urine outside of your menstruation could be a sign of kidney or bladder cancer. Skin changes. Many popular magazines warn people to check for abnormal moles, but there are other skin changes that can signal early cancer. Pigmentation changes are one sign to consider. If you develop severe scaling or bleeding on your skin, then this could also be a sign of cancer. Breast changes. Lumps are not the only change you should be looking for when it comes to your breasts. Other signs of cancer could be redness or thickening of the skin of the breast. Also, nipple changes or discharge outside of breastfeeding should be looked at by your doctor. Unusual bleeding. Abnormal bleeding can be a sign of endometrial cancer or could be bleeding from the gastrointestinal tract, which is a sign of colorectal cancer. Difficulty swallowing. Don't just assume that your difficulty swallowing is just a nuisance. Having difficulty swallowing can be a sure sign of gastrointestinal cancer. A doctor will need to do chest x-rays and take a closer look at your family medical history to know for sure. Bloating. Don't be so quick to write off your constant bloating as normal. While people do struggle with bloating during their time of the month, it can also be a sign of ovarian cancer. This is especially true if it comes with abdominal or pelvic pain. If you become full quicker than you used to without eating a lot of food, then you should contact your doctor. Mouth changes. If you begin to notice white patches inside your mouth or on your tongue, it is time to see a doctor. This is a precancerous sign that can progress to oral cancer if not treated. These white patches are more common in smokers, so be sure to check your mouth frequently if you do smoke. Changing lymph nodes. Your lymph nodes are located on your neck and in your armpits. It is best to check them occasionally for any swelling or changes. If you notice enlarged lymph nodes, be sure to watch them and contact your doctor if they get bigger or if the swelling lasts longer than a month. Fatigue. Fatigue is a very common symptom that most people have experienced in their life. However, leukemia and stomach cancer show themselves early as fatigue. If you are struggling with constant tiredness, it is best to talk with your doctor to find a solution. While cancer is unlikely to be the cause, your fatigue could be a sign of a different health issue. Persistent cough. Nagging coughs are common during cold season, but if you develop a cough outside of being sick or have a cough that lasts more than 3 or 4 weeks, then talk with your doctor. A doctor can rule out cancer by checking your throat and lungs. Indigestion. Most people will experience some degree of indigestion after a heavy meal or while pregnant. Frequent indigestion while following a healthy diet could be a sign of esophagus, stomach, or throat cancer. Ask your doctor to check it out. If it is not cancer, then your doctor can treat your indigestion to prevent future damage. Fevers and infections. If you consider yourself a healthy gal and you find that you're getting sick or feverish frequently, this could be an early sign of leukemia. Keep an eye out for flu-like symptoms that come frequently and are hard to get rid of.